As a nurse, you will make mistakes. Some of them are inevitable, some of them are preventable. But at the end of the day, it all depends on how you learn from them, how you react when they do happen, and how you take accountability. So let's talk about those mistakes so we can prevent them. Hey guys, and welcome back. For those of you who are new here, my name is D'Amber. I am 28 years old. I'm currently a registered nurse, but I'm also in school to get my nurse practitioner's degree. I am also finishing up my last assignment, traveling for a little bit in Columbus, Ohio, and my next journey would be me working in the PACU. So I'm making this video just to share a little bit of insight on like mistakes that nurses make, no matter if you're a new grad, if you are a nursing student, or if you have been in the profession for a little while. Like, these are all some mistakes that nurses have made. I have made them, and I've seen some of my coworkers make them as well. So I'm gonna help you guys not make those mistakes so we can save patients and, you know, save our license at the same time. Before we get started, I do want to thank you guys for watching my videos, liking, sharing, and subscribing to my channel. I also really like when you guys comment. I love to read the comments. I love to respond to the comments. It kind of gives me something to look forward to. So make sure you guys keep commenting, and let's just, you know, keep learning about the nursing profession and the do's and the don'ts, the pros, the cons, all the things that nursing has to offer. I want to start off by saying this video is not about judging anybody. It's not about scaring anybody. It's simply about giving knowledge about things that I've witnessed, things that I've done, and things that we can literally avoid to prolong patients' life, to keep their quality of life where it's at or even better, and to just keep our license, once again, safe. So my number one thing is that I feel like a lot of nurses, especially new nurses, make the mistake of knowing it all. Never be afraid to ask a question, because you never will know it all. Evidence-based practice is a real thing. Hospitals do go off of that as well. So you could have been at a hospital on the same unit for 5 years, and a new evidence-based article could come out, and we could be the ones trialing it, which means the policy would change on how you need to do things. So never feel like you know everything. Like, ask questions if something seems off, advocate. You have to do all of those things. Don't be afraid to, you know, ask a question, no matter who you're asking it to. Mistake number 2 that a lot of nurses make is not asking for help early enough because they don't want to seem incompetent. I will tell you this, asking for help late is more dangerous than asking for help earlier. Like, if you see something is wrong, let the doctors know. Ask another nurse to come assess them. Like, you have to advocate for your patients. You have to make sure they're safe. You have to make sure, you know, the family knows that everything is going to be okay, or if there's a change in status, that the family even understands what's going on. So don't wait because you don't want to seem, you know, incompetent or like you're not as good of a nurse. Like, advocating for them, even if nothing is wrong, it's still better than not saying or waiting too late to say anything at all. It's kind of like if you have a kid or a family member that you know something is wrong, you're not going to sit there and wait because you're like, well, maybe it's going to check out. You're like, I've been with this patient for this long. I know that this isn't normal for them. I'm going to have the doctor come by and check on them. Now, whether the doctor decides to do anything or not, that's on them. But you know what you did? You checked on that patient. You realized something was wrong. You advocated for them, and you reached out to the provider. So at that moment, you've pretty much done everything that you can do. It's the provider's responsibility now to determine if they're going to do any further interventions, but you've literally CYA'd yourself. Another mistake that I feel like nurses make is time management. It's one of those things that once you learn how to do it, you kind of don't unlearn it. So for me, example, I feel like time management was always like, I grasped onto it quickly, especially because I was a CNA. So I kind of knew, like, I'm gonna do vitals and I'm gonna get blood sugars at the same time. And then I'm gonna round back on everybody and see who wants a bath. So when I became a nurse, it kind of was easier too. Like, hey, I'm gonna do this patient's assessment when I walk in the room. I wanna pass their meds, empty out their urinal, and ask them, do they need anything before I leave? And then we're gonna get everything figured out before I walk out of that room. That way, if an emergency does happen, I'm available for it. Another example that I like to use too is that sometimes when you get on your MAR, you'll see a patient has a med at 1, 2, and 3. I'm not going in there at 1, 2, and 3. You have an hour before and an hour after the past med. So I'm going in there at 2, because me going in there at 2 will help me save an hour at 3 and save an hour at 1, just in case, like I said, if an emergency happens or I need to be somewhere else, I have the time to be there and not worried about my patient's meds being late. So time management is super important. I think it really needs to be taught, and once you get it, I mean, there's no going back. It literally makes your job so much more easier. Another mistake is not trusting your intuition or your gut. If you feel like something is off, there's a great chance that it is off. I have done this a million times where I've been like, something seems off, but I'm gonna give it a little bit. And I promise you, every time I feel like something seems off, it literally has been off. Like, I've seen patients who literally were fine 10 minutes ago, and now their increased work of breathing, shortness of breath, can't hold oxygen, their oxygenation stats are decreasing. I'm putting them on 15 liters on the floor, like, and in 2 seconds they're being intubated at bedside and they're going downstairs to the ICU. Like, if you feel like something is not right, literally advocate for your patient. Get the charge nurse involved. If you need to call a rapid, call a rapid. If you need to page the provider and have them come to bedside, do what you feel is needed to keep that patient safe, to keep your license safe, and to let the family know that you've advocated and you've done everything you can in your power to make sure that their family member is taken care of. That literally goes a long way. But like I've said, if you feel like something is wrong, just say something. Don't sit there and wait, and speak on it. Another thing that nurses do is they don't document clearly. And I've been guilty for this too. There's been times where I haven't documented something and I've been like called in the office and we had to talk about it, and I have to like try to dig hard in my memory. Or there's been times where events have happened with providers and they'll say something has happened that didn't happen, and now I have to like advocate for myself and like say, no, this is what really happened, and it all could have been saved if I would have documented. So now what I do is, me personally, if something happens, regardless, patient complained of pain, reached out to the doctor, let them know that the narcotics that they have are not helping. Can we get a new order, or can we try something different? That would be a no. Like, I make everything a no, just to let the people know, like, hey, I've reached out, the provider is aware. Now, if they decide to do anything, that's on them. Like I said, once you reach out and the provider does nothing, there's literally nothing else you can do. There's nothing much more you can do unless it's a serious matter. Then we can call those rapids and get those more those more experienced nurses on the floor, and they will help escalate the issue if it really needs to. But like, document, like, you have to document like your turns, your baths. People would develop pressure injuries so quick in the hospital, like their pain before and after the medication was given. Like I said, adverse events, times that you've reached out to the doctors with no responses. Like, just document, just cover yourself by documenting. Like, it literally can save your license, save your job. It can save, a lawsuit, all of that. Just document. Another mistake that people do make is taking everything personally. You truly have to understand that this is an emotional time, not only for the patients, but for some providers, because it could bring back memories, and then nurses as well. So just try not to take a lot of things personal. Like, a lot of the times, people's anger isn't really towards you. It's towards their condition. It's towards, things they've tried to do to decrease, family stuff that they've had happen that caused these things. So a lot of the times, like I said, anger is not even like towards you. So you just have to learn how not to take a lot of this stuff personally. Like, if you do, that will literally burn you out. Because I can't tell you how many times I've been cussed out at bedside, or how many times providers have like yelled at me over something they could have literally looked up and I wasn't by a computer at the moment. Or like how many times coworkers were frustrated about something that truly had no idea, you had no control over. So like, don't take anything personally. As long as when you clocked out, you did everything you could do for your patients, your unit, and yourself, that's all that matters. But I promise you, if you take everything personally, even going through nursing school, you can't take anything personally. I'll give you an example. My very first clinical at a trauma center, my last semester, I had a patient, dementia. And I'm in there like, hey, I can't even remember his name. I'm like, hey, trying to wake him up to take his meds. He finally opens his eyes. He looks at the bed, looks up at me and says, "What are you doing, you?" And I just looked at him, and I promise you, that was the first and the last time that I've ever cried over that. Now I'm just like, it is what it is. I can't stop you from having your feelings. I know what I am. I know, you know, whatever. So I no longer take, you know, slurs. I don't take being called out my name. I take none of that personally, because at the end of the day, it's, you know, it's my job to be here. I won't tolerate the disrespect. You know, I will have a conversation if they're learn oriented, like, hey, I'm here to help you. I won't tolerate it. You know, we can come to a common ground. We can figure this out. But like, you know, I kind of need you to chill. It's those type of conversations that I will have. But like, I don't go home like crying about things that people have said to me at bedside. Like, no, we can handle it here. You can get a new nurse or you can respect me. It's one of the two. I do this one a lot. Another mistake, don't skip out on your own needs. And when I say that, don't skip your lunches. I no longer skip my lunch regardless if I'm eating or not. Sometimes I take a lunch just to get off of the unit so I don't have to hear the call lights. I don't have to hear the alarms going off. I don't have to hear the drama that's on the unit. I take my 30 minutes and I go. You will not see me for 30 minutes every shift when it's time for me to have a meal. Like, I'm gone. So that's another thing. Picking up those extra shifts will burn you out. So do it with caution. I know the money can be good, especially when they're offering those $20, $30, $40, $50 extras. It is so rewarding when you get your check. But, you know, take care of yourself too. You know, make sure you have your rest days, your mental health days. Make sure you get, you know, your pedicures if you do that. Whatever you do that you like to do. Read you a good book. Just make sure you take care of yourself and your mental health. This career, this profession can be a lot and it can wear you down quickly. So set your boundaries, take your breaks, and do everything that you need to do to make sure you give proper care to your patients. Lastly, I want to let you guys know that making mistakes does not make you a bad nurse. I promise you it doesn't. Like, I've made a lot of mistakes, and you know, some of them I cried about, some of them I've been like, I would never do this again. Like, but those mistakes help you learn. I promise you, everything that I've done, I've literally learned from. Now, it makes you a bad nurse, in my opinion, when you make a mistake and you keep making the same mistake and not learning from it. Because why would you give this lady metoprolol and her heart rate is already 40? Like, let's think about this here. So, you know, mistakes, you learn from them, you keep them pushing, but those mistakes actually make you a better and a stronger nurse, really. So those are all my tips and my mistakes and things that I would try to avoid as a nurse. So with that being said, thank you guys for watching this video. I appreciate you guys more than you guys will ever know. Make sure you guys leave those comments, ask those questions, you know, like and engage in this video, and I will see you guys next week. I do apologize that this video was late, but I literally had a lot of things in life personally that just happened the last couple weeks. So hopefully I will see you guys the following Saturday after I get moved to my new city for my new PACU position. But I appreciate you guys so much. Thank you. Bye.